Hello everyone, today we'll be studying about the planning and evaluation. Let's begin with the definition of the plan. According to E.C. Banfield, a plan is a decision about the course of action. The health planning is defined as the orderly process of defining the community health problems, identifying the unmet needs, and surveying the resources to meet them, and then establishing the priority goals that are realistic and feasible, and projecting the administrative action to accomplish the purpose of the proposed program. What is the purpose of the planning? To match the limited resources with many problems, to develop the best course of the action to accomplish a defined objective, to eliminate the wasteful expenditure or duplication of the expenditure. So now let's begin the steps of the planning process. The steps of the planning process includes the identification of the problem, then conduct the need assessment, after that collection of the data, analysis of this data, determine the priorities, then development program of the develop the program goals, objective, activities, goa, then identify the available resources, identify the constraints, identify the alternative strategy, that is plan B. Now choose those activities that are more effective, develop the implementation strategy, then implement, monitor, and then evaluate. So let's begin with the step by step. Now identification of the problem, then we have the conducting a need assessment. The reasons to conduct the need assessment is to identify the extent and the severity of the problem, to know the cause of the problem, and to evaluate the effectiveness of the program by obtaining the baseline information. Now, the next is the information required include the description of the population, like the number of the individuals in the population. Similarly, the geographical distribution of the population, the population density and the degree of urbanization, the rate of the growth, the ethnic background, the educational status, socioeconomic status, diet and the nutrient levels, the general health profile, the distribution of the dental disease. Next is the resources available, like the public and the private school system, the transportation, public transportation in the area, healthcare facilities available, dental program in the community. Next is the water fluoride level in the area, government policies in the area. We know that conducting the need assessment can be very much costly with respect to the funds, labor and the time. Therefore, the other option are to coordinate with the research activities of other health agency to investigate the past surveys done. Now, then after the conducting the need assessment, collection of the data, analysis of the data. Once the data is obtained from the need assessment, the information must be analyzed before the priorities are determined. One of the example is knowing the fluoride content of the water is important for the planner so that he can decide whether the fluoride supplementation program is necessary or not. Now, next is the determining the priorities. The priority determination is the method of imposing the people's value and judgments of what is important onto the raw data. With the limited resources, it becomes necessary to establish the priorities. If the priorities is not determined, the program may not serve those individuals or the groups who need the care most. Now, when setting the priorities for a community, the planner must ask how serious is the problem and what percentage of the population is affected by it. Now, next is the development of the program goals, objective and activities, GOA. The goal. A goal is defined as the ultimate desired state towards which the objective and the resources are directed to improve the oral health of the school age children in the community X. An objective is precise, it is either achieved or not achieved. Now, there are two types of the objectives, outcome objective and the process objective. Example of the outcome objective: by the year 2025, more than 90% of the population aged 6 to 17 years in the community X will not have lost any teeth as a result of the caries, and at least 40% will be caries free. Next is the process objective. It is more specific. By the year 2025, at least 90% of the population is 6 to 12 years in the community X will be covered under the school fluoride mouth rinse program. Now, we already discussed the goals, objective. Now, activities. The activities include three components: what is going to be done, who will be doing it, when will it be done. The next is the resource identification. It includes M3, T2, KS. M3 means manpower, money, materials. T2 means the time needed and the technician. K means the knowledge. S means the skills. So, the time needed available for the performance or support of the action directed towards the specified objectives. Now, criteria used to determine what resources should be used are appropriateness, the most suitable resources to get the job done; adequacy, the extent or the degree to which the resources would complete the job; effectiveness, how capable the resources are at completing the job; efficiency, the cost in terms of money and the amount of the time expended to complete the job. Now, next is identifying the constraints. The constraints may result from the organizational policy, the resource limitation, or the characteristics of the community. For example, lack of funding, labor shortage, or the restrictive governmental policies, inadequate transportation system, or the negative attitudes. Now, next is identify the alternative strategies. That means if plan A does not work because of the constraints, now we'll have to think about plan B. Being aware of the existing constraints and given the available resources, being aware of the existing constraint and given the available. The next is the identify the alternative strategy. That means if the plan A does not work because of constraints, then the plan B should be executed. That is, being aware of the existing constraints and the given available resources, the planner should then consider alternative sources of the action that might be effective in attaining the objectives. It is important to generate a sufficient number of the alternatives. Now, example. In the rural setup where the adequate transport facilities is not available, commuting to the dental clinic might be a constraint. Therefore, a mobile dental clinic is in place of the fixed dental clinic might be alternative strategy. Now, the develop the implementation strategy. An implementation strategy for each activity is complete when the following of the questions are answered. Why? The effect of the objective to be achieved. What? The activities required to achieve the objective. Who? Individuals responsible for the activity. When? Chronological sequence of the activities. How? Material, method and the techniques to be used. How much? A cost estimate of the materials and the time. Now, implementation. The process of putting the plan into the operation is referred as the implementation. The next is monitoring. The monitoring is the day-to-day follow-up of the activities during their implementation to ensure that they are proceeding as planned and are on schedule. The data typically collected for the monitoring includes the input data, the process data and output data. Now, evaluation. Evaluation is defined as the collection and analysis of the information to determine the program performance. The type of the evaluation includes the formative evaluation, that is need assessment or the relevance evaluation. The second is the process evaluation. Now, two is the summative evaluation, that includes the output or the effectiveness evaluation, and B is the impact evaluation.